I'm Mark Altholz, Executive Vice President of Sales from Partners Pharmacy, and welcome to Passport. Passport is a remote automated pharmacy that we currently have deployed at over 150 facilities across the country. The way this technology works is the pharmacy sends an electronic message to the Passport within a skilled nursing facility, let's say at midnight, and the Passport machine will automatically package the morning shift of medication or whatever the next shift of medication is. So for example, this is what the medication is going to look like when a nurse retrieves it from the Passport machine. She's got her shift of medication by resident, by room number, including control medications. The Passport machine can accommodate 176 different medications for packaging, and that's what you see here. Each one of these med arrays has a primary and a secondary supply of medication, and each is controlled by manufacturer's lot number. So you've got your primary supply of medication. Each is picked up by a probe as it's loaded into the Passport packet. And the probes are always specific to a medication. There's never a commingling of medication. This is the secondary supply, which is replenishment that's done at the pharmacy and then loaded by pharmacy staff at the facility. You'll notice each has a barcode and a chip so that there's never confusion over which medication got loaded where. There are multiple QA systems. The same way whenever you go to an ATM machine and take out $100, somehow the ATM doesn't give you 5 100s by mistake. The same is true with the Passport. It's a very, very secure technology. In fact, last year we packaged on site over 33 million medications, and we have less than 32 reported errors with Passport. So with an accuracy rate of greater than 1 in a million, you really get a sense of how awesome this technology is. Some of the other pieces of this technology that are so impactful include, you'll notice underneath these med arrays what you have are bulk drawers. And within the bulk drawers you can have 125 additional medications for first dose and stat. So those would be non-oral solids like liquids, inhalers, patches, injectables. So if you think about first dosing, you've got 125 bulk items, you have 176 oral solids for packaging. It's over 300 medications on site available for first dose. What you also have are 176 medications for packaging for use during the med pass. That will get a facility to over 80% of their utilization packaged on site. Now, when we've done time studies at facilities across the country that we service, when we compare Passport to punch cards, we're saving over 2 minutes per resident per med administration. So if you think about what that means to your facility, if it's a 120 bed facility, 2 minutes per resident is 240 minutes. That's 4 hours. 3 times a day, it's 12 hours. 30 days in a month, that's 360 nursing hours of efficiency on med administration. Now think about your control meds, because they're packaging out of the Passport. Your shift-to-shift count is limited to just liquids and patches. So that's another 15 minutes, 2 nurses per med cart, 3 times a day, 30 days in a month. Assuming you have 4 med carts, it's another 200 hours of nursing efficiency. Now think about all the med waste and med destruction that no longer is occurring, and what that means in terms of savings, because you're not destroying that medication. One additional piece is cost containment. With Passport, all of the billing is post-consumption, which means at the end of the month, the pharmacy adds up the number of medications per resident that were actually dispensed, packaged, and a single claim is generated for each. So post-consumption billing makes a tremendous amount of sense because you're no longer paying for medication that you're not using, that you might have sent home with the resident. Now, it's true, some of it might be returnable to the pharmacy for credit, but remember, a lot of times there's a restocking fee. Who's really tracking those returns? We find on average we're saving $157 per resident admitted to the facility in terms of cost containment from Passport. So as you think about the world of higher acuity residents, a need for efficiency and a need for cost containment, the positioning of your facility as a leading provider, getting the referrals from the ACOs, having first dose medication, new admission meds, but also maximum efficiency for your nursing staff, that's what Passport's all about. So thank you for visiting.